Our next presentation is the role of steroids in diabetic macular edema by Dr. Annette Lowenstein.
Thank you very much. I would like to thank the organizers for inviting me to talk in this diabetic macular edema session about the role of steroids in this disease. And I would like to pose the question if there is a role for steroids in the management of diabetic macular edema. So over 2/3 of clinicians worldwide use anti-VEGF agents as their primary treatment for diabetic macular edema, as has been shown by the PAT survey of 2018, the last time this question was asked in this survey. However, when we manage patients with DME, we face significant variability in visual acuity, in the level of edema, in the location, in the existence of intraretinal lipids, and the severity of diabetic retinopathy. And the pathogenesis of the disease is pretty complex. It involves not only an increase in VEGF, for which anti-VEGFs are excellent, but also a significant increase in the levels of inflammatory cytokines, for which, at least theoretically, steroids have an advantage. This is a 63-year-old gentleman that has diabetes and has significant diabetic macular edema. He's treated by 6 injections of bevacizumab, and many patients do respond, but this one did not, and responded nicely to Ozurdex. So according to what has been shown to you, even today by Neil Bressler, and the sub-analysis performed by the investigators of the DRCR-NET, both in Protocol T and in Protocol I, there were about 40 or even greater % of the patients who had persistent edema after 6 monthly injections. And these patients paid a price. At least according to Protocol I sub-analysis, their chances for improvement in visual acuity in all parameters was lower than the ones that did not have such persistent edema. So I would like to argue that yes, steroids have a role in treating DME in a patient who is not responding to an anti-VEGF. This is a 48-year-old gentleman who has poorly controlled diabetes. He has significant edema, and he's very non-compliant. He is not willing and does not want to come to monthly management for the first 6 months. So this patient is treated by Ozurdex, responds nicely, and recurs prior to 6 months. So I would like to argue that yes, there is a role for steroids in a patient who is non-compliant and does not want or cannot come for frequent treatment and monitoring in the first 6 months. This is a 35-year-old lady who is on her 2nd trimester of pregnancy. She is pseudophakic and has significant edema and also PDR. So this patient, being pregnant, is treated by Ozurdex and PRP and is doing very well. So I would like to argue that yes, there is a role for steroids in a patient who is pregnant and has progressive DME with vision loss. This is an 86-year-old lady who just had a stroke 1 month ago. She was treated by Ozurdex up front because of the stroke and did very well, recurred after 5 months. So do we need to exercise caution using anti-VEGF in patients that just had a stroke or MI? The results are controversial. So in Protocol T, for example, APTC events were low in frequency, but not zero, and the meta-analysis performed in this regard gave contradicting results. The one by Avery did show an association, and the one by Tullier concluded that the studies are not powered to answer this question. So maybe we should consider a steroid in a patient that just had a stroke or an MI. This is a patient that has very chronic disease with a lot of intraretinal lipids. Treatment was suggested many times but was refused by the patient. So this patient is treated by Ozurdex and is doing very well, recurs and is doing well after a 2nd injection of Ozurdex. So the effect of steroids on eyes with chronic edema has been shown in many trials, the most convincing of which is the famed trial looking at fluocinolone, Iluvien. So fluocinolone effect was greater in patients with chronic edema as compared to the standard of care in a statistically significant manner. The effect of steroid on eyes that have a lot of intraretinal lipids has also been looked at in many trials, the most convincing of which is the Bevordex trial performed in Australia, showing that in Ozurdex-treated eyes, plotted in the white columns here, there is a greater and more rapid regression of lipids from the foveal center as compared to bevacizumab in a statistically significant manner. There was also a greater decrease in lipid area, but this was not statistically significant. So maybe also in a patient that has chronic edema and significant lipids, we should consider steroid for treatment. Protocol U of the DRCR-NET compared ranibizumab monotherapy to a combination of ranibizumab with Ozurdex. And when you look at the pseudophakic cohort, then there was at least a numerically benefit to the combination. Still, in the ASRS survey of 2018, 12 to 32% of the participants, depending on the region, said that they were more likely to use steroids earlier over continuing anti-VEGF following the results of Protocol U. So in all of these indications that I now mentioned, because of the beneficial effect of steroids in pseudophakic eyes that has been shown in the MID trial for Ozurdex, in Protocol I for triamcinolone, we prefer to use steroids in eyes that are pseudophakic. Will there be a role for steroids in DME in the future? We have a lot of new agents coming up, agents that have also an anti-inflammatory potential, such as faricimab, agents that have a longer duration of action, such as brolucizumab and faricimab. Again, slow-release devices that are coming up that will lower the need for frequent injections, such as the PDS. And we have new methods for remote screening using artificial intelligence that were mentioned today also that are coming up, which may lower the chances for chronic untreated diseases, such as the IDXDR. So until we have all these innovations clinically available for us, there is still a role for steroids in a patient who is non-responder, non-compliant, in pregnant patients, recent stroke or MI, maybe in a patient that has chronic edema in intraretinal lipids, and maybe also in combination in resistant eyes. Thank you.